Hi everyone, you're welcome back to my channel. I'm back with another video which is purely educational. It's about a midwife who was suspended for 18 months for lack of competence. If this is the first time you've come across my channel, my name is Becky Sechere, UK registered nurse, and I share tips and advice to overseas nurses, especially working and living in the UK, and any other nurse, whether you're already here and you know there are things you don't know and you find these videos educational, why not? If you have not yet subscribed, please remember to subscribe, like and share. So if you want to know more about what happened, you need to watch the video to the end. You're welcome back to the main video. So once again, I'm going to be talking about some of the situations or cases or concerns that are considered by the UK Nursing and Midwifery Council for fitness to practice cases. Not everything is considered, but there are a few things that are considered. One of them is misconduct cases, another one is lack of competence, another one is criminal convictions or cautions, another one is not having the necessary knowledge of English because we practice in English in the UK, and according to the NMC registration requirement, you should be able to pass those exams, IELTS or OET, to prove that you can speak and understand English. So if you don't have the necessary knowledge of English, then you have a problem. Another one is on health grounds, and with that it doesn't mean you have certain conditions so you can't practice as a nurse, unless of course you have a medical condition that would affect your fitness to practice. Yes, you need to self-refer to the NMC. Another one is determinations by other health and social care organizations. So let's go into today's video now. So this nurse, midwife, was referred to the NMC by an anonymous person for lack of basic knowledge and skills required for practice as a midwife, and the person was unable to practice without supervision. As we all know, midwives do a great job. All nurses do very good jobs, as well as midwives. And midwives, or as a midwife, you are taking care of a mom-to-be and their baby. So you have two people under your care at a particular time. The rest of us general nurses, we look after one patient. Yes, we care for the families as well, but you know, midwifery is completely different. You have the lives of two people in your care. So you need to be absolutely spot on in everything you do. You should be, you know, like that. Anyway, so this person registered as midwife in 2020. So what are the details of the charges? So I've written this thing, so bear with me when I'm looking away. So this person, after qualification or after registering as a midwife, I don't know whether the person had practiced overseas before coming or registered or trained here. I don't know about those facts, so I'm not going to say or speculate. So apparently the person on registration as a midwife was a supernumerary for 7 months. So supernumerary means that you are not counted in the numbers of staff on duty at a particular time, and you are normally assigned a mentor to supervise and support you. So she's been given 7 months supernumerary period. Most of us, you know, within a short period, you are pushed to start. Anyway, so this is what happened. And over the 7 months, this midwife was not able to perform basic postnatal examinations. And some of the charges again was that she could not use a CTG, which is used to monitor the baby's heartbeat and all those things. Is it heartbeat? Midwives, you should correct me anyway. I'm not a midwife. And this nurse is unable or was unable to translate a CTG tracing. She was unable to perform urinalysis. And you know the importance of urinalysis in pregnancy or in anybody anyway. It could be urinary tract infection, or it could be you're looking for protein in urine, and protein in urine is one of the signs of preeclampsia, if you know. Or maybe sugar in the urine or glucose in the urine could mean a lot of things. She did not understand the significance of urinalysis. She wasn't able to palpate the fundus. Those of you who are midwives or who have been pregnant before, the midwives do palpate the fundus. She wasn't able to do that. She was unable to recognize the significance of asking about lochia. So we all know what lochia is. Lochia is the discharge that women have after delivery, which is a mixture of, I don't want to talk too much about these things. You can find out for yourself. Anyway, and she also failed to check the baby's fontanelle. We know the baby's fontanelle is the soft spot on the head of the baby when they are born, which takes a long time before all the bones, fuse together or develop together. She was unable to demonstrate knowledge in areas of things like bladder care, lochia, uterine involution, breastfeeding, urinalysis once again, CTG tracing, maternal and baby observations. These are very important. So she could not, as well as unable to perform those, she was unable to demonstrate knowledge in those areas, and she wasn't able to put policies for further, policies for further learning sessions. She was also unable to communicate adequately with mothers when conducting postnatal checks. She wasn't able as well to escalate abnormal observations. As you know, being a nurse or midwife, when you're looking after a person and their observations are abnormal, you need to escalate to the next person to make sure an action is taken for the safety of that patient or woman. She would not ask mothers if their body was hurting during a postnatal checks as well. She could not demonstrate sufficient knowledge around medication administration. As a nurse and midwife, you need to have a lot of knowledge about medication administration. Why are you administering? Are you administering at the right time, the right dose, the right patient, and all those things? Sometimes you need to know you need to know the side effects of the medication you're giving as well. She was unable to demonstrate knowledge of the presenting part of when performing abdominal palpation. So as midwives, when you're performing abdominal palpation, they know whether it's the head here or whether it's breech presentation, head presentation, or things like that. I did a bit of midwifery as part of my training back home in Ghana. During our training, you will have to do every little of everything. So you are like knowledge in everything, but not a master of that necessarily. Anyway, she could not actually calculate the correct infusion rate for 1,000 ml of normal saline over 8 hours. So as a nurse or midwife, if you're going to be hanging up an infusion, maybe fluid for a patient, you need to know, okay, this is 1,000 ml. How much am I going to administer this over 8 hours? I think, if I can remember, on my ward days, loads of years ago, I think straight away it's 125 mils per hour, because if you divide by 4 hours, it will be 250, isn't it? And then, so yeah, that's correct, I believe. Please comment in this comment section. She also failed to examine the legs of a patient. She attempted as well to administer paracetamol to a patient who already had cocodamol. Those of you who are new to the UK, I didn't know about cocodamol when I came 20 years ago. Cocodamol contains paracetamol. So if you're going to be giving a patient cocodamol, you need to find out whether they've already been administered paracetamol or not. So she failed, or she attempted to administer paracetamol to a patient who has already taken cocodamol. She also failed to identify an elevated pulse rate of 110 to about 122 beats per minute. So somebody's pulse rate is so high, she could not identify or escalate that this is out of range and I need to do something about it. So that's a bit dangerous, I would say. Apparently, she also had poor communication skills by not introducing herself to patients. In the UK, as a nurse, as a midwife, if you're going to perform something for a patient, anything you're going to do with the patient and you're meeting them for the first time, you need to introduce yourself. Remember that. And also, she could not recognize that somebody's saturation, oxygen saturation, 93% on room air, you need to do something about it. You know, at least it should be over 95 and above. So 93 means there's a problem and you need to escalate, or you need to do something about it. She also failed to adequately escalate a baby suffering a fit. So a fit is like a seizure, and she said to a parent that the baby is doing that thing again. You should use some nursing or midwifery term. It's a fit. You don't say the baby is doing that thing again. What is that thing? You know. Anyway, unable to explain how to escalate a mother or a patient with low BP. So this is very important. If a mother has had a baby or a patient has had a baby and they've got low blood pressure, there are several reasons. It could be the person is losing blood, anything at all. So you need to escalate, you need to identify that, you need to explain what is going on so you can, you know, keep that patient safe. She also failed to demonstrate an understanding of palpitation. So if someone is having a palpitation, what does that mean? Hyperemesis. What is hyperemesis? Most of you should know. So women become pregnant and they vomit a lot. They can't keep anything down. That's how hyperemesis gravidarium. Those days, I can remember my terms. Anyway, you can put in a comment section what you think would be happening if a pregnant woman or someone who has had a baby is having palpitation. What could that mean? If someone is having hyperemesis, what do you understand by that? And you know, and she also failed to demonstrate an understanding of antenatal checks. Why do you do antenatal checks? As I said in the beginning, a pregnant woman has her life and that of a baby she's carrying, and as a midwife you have this person in your care. So anyway, over the period before she got referred, several meetings were undertaken. Personal development plans were put in place. She was given mentors to help. Still, she wasn't meeting those requirements. Therefore, she was downgraded from band 5 midwife to a band 2 healthcare support worker to allow her to take her time to meet the requirement. So, unfortunately, the staff failed to meet and complete the action plan in her personal development plan, as I said. So she was offered a permanent role as a band 2 healthcare support worker. So what are some of the NMC codes that were breached in this case? One of them is treat people as individuals and uphold the dignity of those individuals in your care. You need to listen to people and respond to their preferences and concerns as well. You need to make sure that people's physical, social, and psychological needs are assessed and responded to. And in most of these cases, that did not really happen. And apart from that, what happened? So her fitness to practice, unfortunately, has been found to be lacking by reason of competence anyway. And also noted that she would pose a risk to patients if measures are not taken. Therefore, the 18-month suspension order, interim suspension of 18 months order was imposed to allow this person or staff time to develop her clinical skills at band 2, as I said, and potentially undertake further studies as well. And her case would be reviewed again before the suspension period ends. So in this scenario, what do you think about this person's situation? Do you have any comments? You can write that in a comment section. What do you learn from this? Clearly for me, I realized that there is lack of competence in basic nursing and midwifery knowledge and skills. I would actually be very worried if I was pregnant to be looked after by someone who don't really know what they're doing, because once again, it's my life and it is the life of the baby or fetus that you are carrying as well. Low BP, as I said, could be as a result of several things. Issues around cocodamol being given to someone who, or paracetamol being given to someone who already had cocodamol, not knowing what urinalysis means or how to perform it and what the implications are, and glucose or whatever. As I said, urinalysis would reveal a lot of things, and those things could be, you know, the fact that this person is at risk of something serious. And what do you think? What are your thoughts? You know, it's a shame. I don't know where the person trained once again, so I cannot say. So anyway, share your thoughts. I hope this video has been helpful. Basically, if you're somewhere and you're thinking of relocating to UK as a nurse or as a midwife, you need to make sure you're on top of your game. Yes, when you get here, you would be supported. But most places, some of these things are basic things that you should know as a midwife. I remember when I was training, I can't remember us using CTGs in Ghana, but that is over. I trained, I finished university in the year 2000, so, or nursing training from the university in 2000, so that's 24 years ago. So I know things would have changed. So other parts of the world, definitely the same, but you know, things are changing in the world. In medical field, they're using AIs and all these computer related things. Robotic surgeons or surgeries are happening and all those things. So, you know, you need to be abreast with what is happening. If you're not too sure, the internet gives you everything. YouTube, you learn a lot from these platforms, and there are a lot of videos out there. You can learn some of these things, and if you're not sure of anything, make sure you ask so that somebody would show you. Anyway, take care of yourselves, and I'll see you again later. Bye bye.